I think the thing that makes the University of Virginia so special and the Department of Plastic Surgery are really the people, the way in which they communicate with each other, treat each other with respect. It's a situation where people want to come into work and they want to be around each other. And I think that makes all the challenges that much easier when you have a good group of people that you enjoy working with.
What drew me to UVA was in 2007. I came here as a resident trainee. I was particularly interested in the Apprentice style residency where you could work one-on-one with various faculty, as I thought that being a good surgeon, the way to learn how to do that was to emulate all the different parts of the practice of that surgeon and do what they do as much as possible, so that way I was the most ready to do that when I was out in practice.
I love working here at UVA because of the amazing community of physicians, nurses, and other staff who are all engaged and committed to patient care and excellence. We provide excellent care while educating residents on plastic surgery, seeing a diverse number of problems, and really having a collegial environment.
My favorite part about working with the other residents and fellows here is that everyone gets along really well and are great team players. I think that there's always a willingness to help each other out, and I think that willingness is sincere in that everyone really is happy being here and also is hungry to learn more and really to provide the best patient care that we can.
My favorite thing that I get to do with the residence fellows is get to see their growth from the beginning of the year to the end of the year, as they initially struggle through a case, and then they have this light bulb moment at some point during the year where it just clicks. They really understand the anatomy and how to get through that case, and their confidence shines. And being a part of that is really a privilege, and it's what excites me to work with the trainees every day.
I think that the apprenticeship model that we have is very unique because it really fosters a close working and personal relationship with the attending and resident, because you're working literally hand in hand with the same person for 4 months at a time. Usually it's more of a group mentality, and while you still establish very close relationships with all of your attendings, it is really nice to have the opportunity to spend an extended amount of time with each attending, because that one-on-one mentorship really is extremely valuable and translates to a really great relationship.
There are many research opportunities here. I would say that all of our research projects are supported well within the department, and funding is available for presentation at regional and national meetings that most all of us take advantage of.
The type of research that I do is more applied and in the laboratory, and it's a type of research that a lot of the residents and fellows haven't had the opportunity to do in their careers and training. And so giving them an opportunity to experience that has been very exciting to me. Them coming to me with an idea, something they may see in the OR as an issue, or an idea that's perplexing them. Whether it's the design of something or the utilization of some new technique or medication, coming up with a research plan to try to be able to answer that question in a more rigorous way is something that I find very satisfying.
Right now we have a pretty wide variety of stuff that we do with the residents. We have both ortho hand / plastics hand conference. We have journal clubs going over old and more recent journal articles. We talk about research at least once a month, and then we have our core curriculum where we cover all the topics within plastic surgery. And then recently we just added our indications conference, and that's a chance for residents to kind of show their pre-op planning skills, their intra-op plan for a patient, as well as discuss any post-op complications that might come up. I've really enjoyed watching the residents grow in their knowledge base and their skill set, and really show off that they are really getting ready to be great skilled plastic surgeons.
We're piloting something called Indications Conference, which is working to prepare the residents for both oral boards as well as success in clinical practice in plastic surgery. It encourages us to think on our feet and succinctly express our ideas about how to manage complex patient problems.
I came to Charlottesville for the opportunity to grow myself as a leader and also to embrace the resources here at the University of Virginia. And I think that's true within our department. We have residents, we have faculty, and we do embrace their growth and their development and also their well-being. And we have the resources to do that, both in our clinical areas. We have top-notch operating facilities and resources, but also with research and education and support and camaraderie amongst our team. And then on top of that, I was really attracted to the community here in Charlottesville. Really a wonderful place to live, great people who all value being a member of this community. And it attracts a lot of people, and the longer I've been here, the more I've realized that not many people leave, and there's a reason for that.
I really appreciate the community feeling of Charlottesville, where you can ride your bike anywhere in 10 minutes in the town. There's plenty of outdoor opportunities that are right outside the door of the hospital.
Charlottesville is a really easy place to live with lots of outdoor activities and cultural events like live music. There's a great restaurant scene. It's also close to places like the Outer Banks and DC and Richmond, which are great for quick weekend trips. And I really enjoy the community aspect of Charlottesville and of the University of Virginia. We have great support both from our other residents as well as the faculty members, which make it a really nice environment for spending 6 years of your residency.
I'm really proud of what we have here and what we're building here. I think that this is a program that has an incredible upward trajectory with a core group of very talented, very friendly, relatively young faculty that are actively increasing and expanding the volume and scope of our practice and offerings here. I'm really excited to be a part of what's happening here in Charlottesville.
What I'd like to finish with is that we have an excellent program here at the University of Virginia in plastic surgery. In fact, this is the first department of plastic surgery in the United States. And we really value our faculty, our residents, and our staff to create a culture of mutual respect and also an individualized opportunity for our residents to develop the best they can possibly be and be successful. We have a tremendous alumni base, and the alumni are involved in our program in many ways. So I'd invite you to come visit us here in Charlottesville and walk the grounds of this historic campus. And I look forward to meeting you in the future.